go display settings.
Top left?
Yeah. And then swap. Yeah.
Okay, thank you.
My name's Stewart. I'm a clinical psychologist and have been for a few years now. And the thing which I guess for me I really like about the clinical psychology thing is just an immense amount of ability, I think, to combine, as Iris talked a little bit about, the scientist practitioner kind of an approach, that there is a practitioner which is very much about being very human, and there is a scientist which is about trying to use the basis of knowledge that has been developed sort of over really almost over the last 100 years that psychology has sort of been a thing, really. And so it's taking those two things together and sort of trying to combine it and use it in a way which is actually going to be of benefit to people. And I think that that's true of all of the other disciplines. And in fact, where I would like to start us talking about is actually looking at the range of kinds of scopes and so on here. And you'll notice that in this one, it's not strictly about scopes of practice because there is health psychologists, and as Iris just sort of said, it's not been actually recognised as a scope, but it really very much is a particular kind of thing. And so we have all of these different kinds of scopes, and what I would like to do is that people often get sort of a bit hung up on the differences between the scopes here, and I want to just bring it back a little bit to thinking about, well, what are the similarities between what all of these different scopes do? What is the essence of being a psychologist in a way? And one recent kind of a diagram thing has been put together to do that, and I'll put some copies of this down here later. It was put together by a group called the Psychology Workforce Task Force, which is something a number of us have been involved in the professional organisations and so on, have been involved with the Ministry of Health, just trying to develop the psychology workforce over time. And part of the question which always comes up when you're working in this thing is, well, you know, why psychology? Why have a psychologist, not a counsellor or a nurse who's learned to do some CBT or something like that? And it's a surprisingly difficult question to kind of answer in a way which is not doesn't raise a lot of hair on the back of various people's necks and doesn't actually create lots of grumpiness in the room. But one way of thinking about it, I think, in a sense, is thinking that there are these three pillars which are developed slightly differently in psychology than they are in many other kinds of traditions. And one of those is around the interpersonal skills, which is huge, particularly when you're doing clinical kind of work. The interpersonal skills, the technical knowledge, which is the scientist part of that. And then the third one is about the kind of integrative skills. It's integrating all of that together and bringing the depth of that stuff which you're learning right from stage one onwards in your psychology, stuff that you're learning in that psychological theory as well as in the practice, and applying that and putting it all together into a way. And perhaps another way of thinking about the same thing is thinking about it as a kind of a step care approach. And this is something which was originally developed, I think, back in the 1980s as a way of conceptualising what it is that psychology does. But it still really, really stands very, very strongly today that hopefully when you've got people that are working with people, everybody's got some baseline skills, which are the kinds of skills which allow you to be able to join with people and allow you to be able to move forward, allow you to help people to be able to make good decisions for themselves, which allow you to be able to help people to explore the issues in their life. Hopefully anybody who works in a health or in a social services kind of thing has the skills to do those things. If it's not, then it's time to get some training. The next level is the level of being able to do competently some kinds of therapies and so on at a reasonably manualised, reasonably consistent kind of an effective way. But then it's this third level, which is the level which, irrespective of scope, I think hopefully is what psychology is bringing into the picture. And that's the ability to take that bunch of diverse theory and so on that you've got, and a bunch of skills which you've learned in your particular area, meld those together and make it into something which can do something particularly useful and particularly tailored to somebody who's got complex kind of issues going on. And that's very much what I see as what I need to do as a clinical psychologist. And I think it's consistent across what all of the psychologists, the different scopes of psychology, and those that are in the psychologist scope, which covers a whole really diverse range of sets of skills as well. So that's sort of an idea of a stepped care, and those of you who are working in mental health will hear about stepped care in different ways. And it's a very, very simple concept, but it's actually a very, very powerful one as well. So thinking about clinical psychology now, more specifically, or thinking about the scope of practice, Iris talked a little bit about her path through health psychology. My path actually, in a sense, started in health as well, because my original training was in biomedical engineering. And in the process of doing that, I got really interested in medical electronics. And I was working a lot with people who had cardiac pacemakers implanted. And I was also working a lot with people who had chronic pain going on. I was also working for Youthline on a voluntary basis at the time. And if I was going to give a tip to anybody who was wanting to actually advance into psychology, I would say get that kind of training, get that kind of background behind you, do some work in some kind of a health or mental health or health social services kind of thing. Get some kind of experience like that. That's hugely important, I think, both for actually checking out that it is actually what you want to do, but also in terms of being able to get into these mostly fairly highly competitive courses. It's a really, really useful kind of a background to have. My path was, as I say, Youthline, and this kind of interest, this fascination that I got with what it'd be like to be living on a piece of machinery. And this was quite a long time ago. A piece of machinery which is inside, which is watching your heart, it's keeping it going. If your heart doesn't beat for itself, then it gives it a little burst. But at this time, those things weren't necessarily all that reliable. They weren't necessarily all that accurate. Sometimes they sort of stop working and so on, older technologies. And so wondering, well, what's it like to be living on that, working with the patients that I was working with. Also with the chronic pain people, just being aware of these people, which didn't matter what people did, this pain did not go away. And so I got so fascinated in that, I decided to sort of go from Wellington Hospital to Otago University via Kathmandu to just sort of check out and start to do a PhD in this area of chronic pain and what was going on there. Now, as a result of that, I ended up falling into clinical psychology. And from that, the clinical psychology led me through pain clinics and through looking at lots of different kind of physical health issues, eventually going and working in the US and for the Centres for Disease Control and things like that, and then coming back to New Zealand and teaching here. But also working a lot in the area of psychosis, people who had developed psychotic disorders, particularly young people, and working with them and their families. And more recently I've been in private practice, and I'll talk a little bit more about that as I go on. So that was sort of my pathway, and like a lot of people's pathways, I think it sort of involved a lot of falling into things rather than necessarily having big, consistent, ongoing plans. But it makes a difference. There are quite a few roots to trip over on the way, of course, as you can see in this picture, but a really nice journey nonetheless. So if I think about what clinical psychology is, this is actually sort of little snippets out of the board statement which defines what clinical psychology is. And so it's something which applies the psychological knowledge and theory, that scientist practitioner idea, to the area of mental health and development, and that's really broadly defined in terms of what that means, which assists all sorts of different people with emotional, mental, developmental and behavioural kinds of problems, and then uses the kind of psychological assessments and therapy kind of processes to help to bring about the change and so on in their life. And so that's very much, if you look down the bottom there, there's assessment, and a lot of that assessment, and Barry may well be talking about this a bit later on, a lot of that assessment is actually not only about looking after the individual and trying to help them to make their lives better, it's also actually looking from a whole societal point of view at people and how those people, from keeping society safe and so forth. The second part of it is actually around linking people with resources. For instance, in the practice I work in, there are a lot of people who do neuropsychological assessment, and so a lot of what they're doing is helping those people often to get the kind of ACC help that they need to be able to do their rehabilitation and do as much recovery as they can. And then the third thing, which is about the therapy, and the therapy is very much aimed towards helping people to create change in their lives. So that's sort of the scope of clinical psychology. The training path looks a bit like this. Your 3-year undergraduate degree, and then at least another 3 years after that, which, depending on your program, they differ a little bit, but those next 3 years start off with a tiny little bit of practical work and a lot of academic work, and then slowly the amount of academic work ramps up over the 3 years, ramps down, and the amount of practicum work ramps up to that. For most programs in New Zealand, in that third year, you're in an internship where you're working 4 days a week in some setting or other, mostly in paid kind of internships in most parts of New Zealand. And so you're working that. At the end of that internship, when you pass your final intern exam and so on, then people come out either with a master's, well, you have to have a master's degree as part of it, or else a Doctor of Clinical Psychology degree, and so you come out with the postgraduate diploma and masters, or else the Doctor in Clinical Psych, depending on which program you go through. So that's the kind of training program. The kinds of settings which people have are quite diverse, and so I'll talk a little bit more about that, because the settings where people work and the kinds of things where people are employed are very similar in terms of the internships. The biggest bunch of clinical psychologists are in health, and the second biggest is in private practice. Now, a lot of these people also work somewhere else. Often they work in health or corrections or somewhere else, but also run a bit of a private practice as well. ACC is quite large, and government non-health, which includes corrections and things like that, is one of the largest. Corrections is a very large employer for lots of clinical psychologists, and they have quite an influential role there. So clinical psychologists also do quite a lot of family court work, where they're actually helping to sort out what's happening, with families and so on, and trying to help judges to make really sensible kinds of decisions about what to do with families to keep kids safe and to keep situations working as well as they can for the parties concerned. So those are some of the examples of the kinds of places where clinical psychs end up working. Within health, 74% of the psychologists who work in health are in DHBs in secondary care. And some of you may well have heard about the strike action which is going on at the moment for psychologists in general working in that area. And that's quite a big thing, because psychologists, I think it's probably the first time, certainly the first time I can remember where they've gone out on strike. So it's quite a big thing. And it's actually, I was meeting with a bunch of psychologists today, and they were really struggling with it. Because I think that one of the things which is very, very, very clear about most psychologists is that they're hugely passionate about what they do. And actually for them to be sitting in a routine like they are at the moment, where they're only able to see people for 2 hours a day, actually hurts. Because they've got hugely strong commitment to their clients and so on. But anyway, that's the kind of breakdown for the psychologists that work in health. Now, this is another way of thinking about that. This is an example from a DHB, and looking at the kinds of services where you have psychologists employed. Most of the psychologists here are actually clinical psychologists, although the purple bit up the top is the physical health services, and quite a number of those will be health psychologists. The rest will mostly be clinical psychologists, with a few counselling psychologists in there, a few people from the general scope, psychologist scope of practice. And that's probably about it really, but mostly clinical psychologists working in a huge range of different kinds of services and places where people can work. Now, about 5 years ago I stopped working for the DHB and I went into private practice. This is the place where I work, which is in Green Lane. Psychologists in private practice end up doing a whole lot of different kinds of work as well, and those are just some examples of it. you know, sort of like neuropsychological assessments and sensitive claims kind of work for ACC are two big areas which psychologists often work in. There's all those other areas of kinds of things, but I thought, seeing as I've been talking about being a scientist practitioner, I should show you some data, which is actually my data for the last month, of the kinds of people, the kinds of issues which I have been working with people on in the clinical work that I do. And this is a sort of my breakdown of the kinds of issues that people are struggling with who I've seen in the last month, and the kinds of things which I've been working with them on. And it ranges from addictions management, you can see up there on the top right, which is often it's about street drugs or it's about alcohol, sometimes pornography as well as something which people come along to work with me about. There's depression management and anxiety management, which is what people often think of the most. But then there's some other sort of some other things which are also very, very, perhaps you would less think of really, which is things like, for instance, I have a politician who's coming along to see me, not because he's got any particular kind of health issues going on or anything like that, but he just really wants somebody to be able to talk with about what's going on, and somebody that he feels that he really can trust, because they've got that kind of professional kind of thing to be able to trust. The work we're doing actually has some quite nice kind of parallels with psychology work, because a lot of what we're doing comes out of a kind of an ACT approach, or acceptance and commitment therapy approach, which some of you might be with. It talks a lot about values. So I'm getting to talk with a politician about values. You know, people might have some different ideas about how likely that's likely to be relevant and so on, but it actually feels very, very useful in some ways. Also, a lot of the work which I end up doing is actually about helping people to improve their quality of life. It's not actually about trying to remove some kind of frank illness, it's actually about improving quality of life. So that's the sort of range of things which I'm doing. Different psychologists end up doing very different kinds of work, but that's the kind of range which I end up doing. And thinking back again to that, sometimes some psychologists do much more of the assessment kind of work, which ends up helping people get the resources they need. My practice is more strongly towards the therapy end of things and helping people to figure out how to bring about change in their own life, which kinds of change they want to bring, and on that kind of range of skills and issues that they're dealing with. So that's clinical psychology, and certainly be available at the end for any questions if anybody's got any questions, if they want to explore some more about that.